Question 1. A client is admitted to the emergency department with sudden onset of crushing chest pain radiating to the left arm and jaw. The nurse's priority action should be to A. Administer morphine for pain relief. B. Obtain a 12-lead electrocardiogram, ECG. C. Administer oxygen via nasal cannula. D. Obtain a detailed history of the pain. Answer: B. Obtain a 12-lead electrocardiogram, ECG. This question tests your prioritization skills in a cardiac emergency, indicated by the keywords sudden onset of crushing chest pain and priority action. While pain relief and oxygen are important, obtaining a 12-lead ECG is the most critical initial diagnostic step to rapidly identify if the client is having a myocardial infarction, heart attack, and to determine the type, which dictates immediate treatment. Administering oxygen or morphine are important comfort and supportive measures that often follow or are done concurrently, but diagnosing the problem is key for definitive intervention. For example, if the ECG shows an ST elevation myocardial infarction, STEMI, the client needs immediate reperfusion therapy. Always remember to diagnose to treat in critical situations, especially when the diagnosis guides life-saving interventions. Question 2. A nurse is preparing to administer digoxin to an adult client with heart failure. The nurse notes the client's apical pulse is 52 beats per minute. What is the nurse's best action? A. Administer the digoxin as prescribed. B. Administer the digoxin and notify the physician. C. Withhold the digoxin and notify the physician. D. Withhold the digoxin and reassess the pulse in 30 minutes. Answer: C. Withhold the digoxin and notify the physician. This question assesses your knowledge of medication safety, specifically for digoxin administration. The keyword apical pulse is 52 beats per minute is a critical clue because digoxin can significantly slow the heart rate. For adult clients, digoxin is typically withheld if the apical pulse is below 60 beats per minute due to the risk of bradycardia, slow heart rate, and potential for toxicity. Withholding the medication and informing the physician allows for an assessment of the client's condition and a decision on whether to proceed with or adjust the dosage. Always remember that patient safety is paramount, and monitoring vital signs like heart rate before administering cardiac medications is a key nursing responsibility. Question 3. A client with a new colostomy expresses anxiety about managing the stoma and changing the appliance. Which nursing action is most appropriate? A. Reassure the client that many people live normal lives with a colostomy. B. Provide the client with a detailed written step-by-step guide for stoma care. C. Demonstrate the colostomy appliance change and then ask the client to perform a return demonstration. D. Ask the client's family member to learn the colostomy care procedure. Answer: C. Demonstrate the colostomy appliance change and then ask the client to perform a return demonstration. This question focuses on client education and psychological support for a new ostomy. The keyword anxiety about managing the stoma indicates the need for hands-on, practical teaching to build confidence. Simply reassuring the client or providing a written guide is not sufficient for overcoming anxiety related to a complex physical task. A return demonstration allows the nurse to assess the client's understanding and skill level, correct any errors, and reinforce proper technique, which is essential for self-care and reducing anxiety. For example, showing a client how to empty and change their bag, then guiding them through doing it themselves, builds critical self-management skills. Always remember that see one, do one, teach one is a powerful teaching strategy for complex skills. Question 4. A client is receiving intravenous fluids at 125 milliliters per hour. The nurse notes swelling and coolness at the insertion site. What is the nurse's immediate action? A. Slow down the infusion rate. B. Apply a warm compress to the site. C. Discontinue the infusion and remove the catheter. D. Elevate the affected extremity. Answer: C. Discontinue the infusion and remove the catheter. This question tests your ability to recognize and respond to complications of intravenous therapy. The keywords swelling and coolness at the insertion site are classic signs of infiltration, where intravenous fluid leaks into the surrounding tissue. The immediate action is to stop the infusion and remove the catheter to prevent further fluid accumulation and tissue damage. Applying a warm compress or elevating the extremity might be done after discontinuing the fore, and simply slowing the infusion rate will not resolve the infiltration. Think of it like a leaky faucet. You wouldn't just turn down the water, you'd turn it off and fix the leak. Always prioritize stopping the source of the problem in an emergent situation. Question 5. A nurse is assessing a 4-year-old child admitted with dehydration. Which finding is the most reliable indicator of the child's fluid status? A. Daily weight. B. Urine-specific gravity. C. Skin turgor. D. Presence of tears. Answer: A. Daily weight. This question targets your understanding of fluid balance assessment in pediatrics, specifically with the keyword most reliable indicator for a child with dehydration. While all the options are indicators, daily weight is considered the most accurate measure of fluid loss or gain in both children and adults, as a 1 kilogram weight change typically equals 1 liter of fluid. Skin turgor and presence of tears can be subjective, and urine-specific gravity can be influenced by other factors. For example, a child weighing 15 kilograms today and 14 kilograms yesterday indicates a 1 liter fluid loss. Always remember that objective measurements, like daily weight, often provide the most accurate assessment of fluid balance. Question 6. The nurse is caring for a client post-thyroidectomy. Which finding requires immediate intervention? A. Client reports hoarseness. B. Client reports tingling around the mouth. C. Client states pain level is 5 out of 10. D. Client has a heart rate of 90 beats per minute. Answer: B. Client reports tingling around the mouth. This question tests your knowledge of postoperative complications following a thyroidectomy and the need for prompt intervention. The keyword tingling around the mouth is a classic sign of hypocalcemia, low calcium levels, which can occur if the parathyroid glands, located near the thyroid, are accidentally damaged or removed during surgery. Hypocalcemia can lead to severe complications like tetany, muscle spasms, and laryngospasm, which is a life-threatening airway obstruction. While hoarseness can occur from vocal cord irritation and pain needs management, hypocalcemia poses a more immediate and severe threat. Think of it like a warning signal for a critical electrolyte imbalance. Always prioritize signs that indicate a potential for airway compromise or life-threatening electrolyte disturbances. Question 7. A client with chronic obstructive pulmonary disease, COD, is prescribed oxygen therapy at 2 liters per minute via nasal cannula. The client's family expresses concern that oxygen might be harmful due to a previous discussion. What is the nurse's best response? A. The physician knows best what your family member needs. B. Oxygen at low flow rates is generally safe and helps improve breathing in COPD. C. We will monitor the client closely for any adverse effects of oxygen. D. Tell me more about your concerns regarding oxygen therapy. Answer: D. Tell me more about your concerns regarding oxygen therapy. This question assesses therapeutic communication and client education, especially when family concerns are present, indicated by the keywords expresses concern and best response. The most appropriate initial nursing action is to explore the family's specific concerns to understand their perspective and any misconceptions they might have. This approach shows respect, builds trust, and allows the nurse to tailor education to their specific needs. Simply stating that oxygen is safe or that the doctor knows best dismisses their feelings and doesn't address the underlying issue. For instance, they might have heard about CO2 retention in COPD, and the nurse can then explain low-flow oxygen. Always remember to start by actively listening to concerns before attempting to educate or reassure. Question 8. The nurse is caring for a client with a history of alcohol withdrawal syndrome. Which medication is most commonly used for acute alcohol withdrawal? A. Haloperidol, Haldol. B. Lorazepam, Ativan. C. Fluoxetine, Prozac. D. Methadone, Dolofen. Answer B. Lorazepam, Ativan. This question tests your knowledge of pharmacological interventions for substance withdrawal. The keywords alcohol withdrawal syndrome and most commonly used direct you to the standard treatment. Benzodiazepines like lorazepam, Ativan, diazepam, Valium, or chlordiazepoxide, Librium, are the drugs of choice for acute alcohol withdrawal because they help prevent seizures, manage agitation, and reduce the severity of withdrawal symptoms by mimicking the effect of alcohol on the GABA receptors. Haloperidol is an antipsychotic, fluoxetine is an antidepressant, and methadone is an opioid substitute, none of which are primary treatments for alcohol withdrawal. Think of benzodiazepines as essentially calming the overactive nervous system during withdrawal. Always remember that benzodiazepines are crucial for safely managing acute alcohol withdrawal. Question 9. A nurse is assessing a client admitted with a severe allergic reaction to a bee sting. Which finding indicates the client is experiencing anaphylactic shock? A. Localized hives and itching. B. Swelling and redness at the sting site. C. Hypotension and bronchospasm. D. Nausea and abdominal cramping. Answer C. Hypotension and bronchospasm. This question asks you to identify critical signs of anaphylactic shock. The keywords severe allergic reaction and anaphylactic shock point to a life-threatening systemic response. While localized hives, swelling, and GI symptoms can occur, the hallmark signs of anaphylactic shock are systemic manifestations like hypotension, low blood pressure, due to vasodilation and bronchospasm, narrowing of airways, leading to respiratory distress. These indicate a severe, body-wide reaction that compromises circulation and breathing. For example, a client's blood pressure dropping to 80/40 millimeter of mercury and experiencing wheezing and difficulty breathing signals a dire emergency. Always prioritize assessing for signs of compromised airway, breathing, and circulation in severe allergic reactions. Question 10. A nurse is providing discharge teaching to a client diagnosed with iron deficiency anemia. Which food choice indicates effective teaching regarding iron intake? A. Spinach and orange juice. B. Milk and cheese. C. Chicken and yogurt. D. Pasta and butter. Answer A. Spinach and orange juice. This question evaluates your understanding of dietary management for iron deficiency anemia. The keyword effective teaching regarding iron intake requires identifying food combinations that maximize iron absorption. While spinach is a good source of non-heme iron, plant-based iron, it's best absorbed when consumed with a source of vitamin C, like orange juice. Vitamin C significantly enhances the absorption of non-heme iron. Milk and cheese are calcium sources, which can actually inhibit iron absorption, and chicken/yogurt provide protein and calcium but not the optimal iron/vitamin C combination. For example, advising a client to add bell peppers or citrus fruits with their iron-rich meals helps increase absorption. Always remember to pair iron-rich foods with vitamin C for optimal absorption. Question 11. A client with a new prescription for warfarin, Coumadin, asks the nurse about dietary restrictions. Which statement by the client indicates a need for further teaching? A. I should avoid eating large amounts of green leafy vegetables. B. I can still eat salads, but I need to be consistent with the amount. C. I will need to have my blood tested regularly to check my clotting. D. I can take ibuprofen for headaches while on this medication. Answer: D. I can take ibuprofen for headaches while on this medication. This question tests your understanding of safe medication practices, specifically drug and food interactions with warfarin. The keyword "need for further teaching" indicates an incorrect statement by the client. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that inhibits platelet aggregation and can increase the risk of bleeding when taken with warfarin, which is an anticoagulant. Clients on warfarin should avoid NSAIDs and use acetaminophen for pain relief. While consistency with vitamin K-rich foods, green leafy vegetables, and regular blood tests, PT/INR, are correct teachings for warfarin, taking ibuprofen poses a significant safety risk. For instance, combining warfarin with ibuprofen can lead to dangerous gastrointestinal bleeding. Always remind clients on anticoagulants to consult their healthcare provider before taking any over-the-counter medications. Question 12. A nurse is caring for a client with a history of falls due to orthostatic hypotension. Which intervention should the nurse implement? A. Instruct the client to change positions quickly. B. Encourage rapid ambulation immediately after waking up. C. Assist the client to sit on the edge of the bed for a few minutes before standing. D. Administer blood pressure lowering medication before ambulation. Answer: C. Assist the client to sit on the edge of the bed for a few minutes before standing. This question addresses client safety and fall prevention, particularly for orthostatic hypotension. The keywords history of falls and orthostatic hypotension highlight the risk of a sudden drop in blood pressure upon standing. The most effective nursing intervention is to teach the client to change positions slowly, specifically by sitting on the edge of the bed for a few minutes before standing, allowing the body to adjust to the change in posture. Changing positions quickly, encouraging rapid ambulation, or administering blood pressure lowering medication, which would worsen hypotension, would increase the risk of falls. For example, a client might feel dizzy and lightheaded if they jump out of bed too fast, so a gradual transition helps. Always remember that slow, deliberate movements are key for clients prone to orthostatic hypotension to prevent falls. Question 13. A client is diagnosed with type 1 diabetes mellitus. Which statement indicates the client understands the most critical aspect of managing this condition? A. I will check my blood sugar every morning before breakfast. B. I know I need to take insulin injections every day. C. I should eat a balanced diet and exercise regularly. D. I need to wear a medical alert bracelet. Answer: B. I know I need to take insulin injections every day. This question evaluates the client's understanding of type 1 diabetes management. The keyword most critical aspect for type 1 diabetes mellitus is crucial, as type 1 diabetes is characterized by the body's inability to produce insulin. Therefore, daily insulin injections are absolutely essential for survival and blood glucose control, making this the most critical aspect. While checking blood sugar, a balanced diet, exercise, and wearing a medical alert bracelet are all important components of diabetes management, they are supportive measures. Insulin is the life-sustaining treatment for type 1 diabetes. For example, without insulin, the client's body cannot utilize glucose, leading to severe hyperglycemia and ketoacidosis. Always remember that for type 1 diabetes, insulin is not optional, it's a daily necessity. Question 14. A nurse is assessing a client with acute pancreatitis. Which laboratory finding would the nurse expect to be elevated? A. Serum amylase and lipase. B. Blood glucose. C. White blood cell count, WBC. D. All of the above? Answer: A. Serum amylase and lipase. This question focuses on diagnostic indicators for acute pancreatitis. The keywords acute pancreatitis and expect to be elevated direct you to the specific enzymes released during inflammation of the pancreas. Serum amylase and lipase are digestive enzymes produced by the pancreas, and their levels rise significantly in the blood during acute pancreatitis as the pancreas becomes inflamed and damaged. While blood glucose can be elevated due to pancreatic dysfunction and WBC might be elevated if there's inflammation, the most specific and diagnostic indicators for pancreatitis are amylase and lipase. Think of these enzymes as direct markers of pancreatic distress. Always remember that elevated amylase and lipase are the classic indicators of acute pancreatitis. Question 15. The nurse is caring for a client with a new tracheostomy. Which action is essential to maintain airway patency? A. Change the tracheostomy ties daily. B. Suction the tracheostomy tube regularly. C. Humidify inspired air. D. Apply a sterile dressing around the stoma. Answer: B. Suction the tracheostomy tube regularly. This question emphasizes the critical care of a new tracheostomy. The keyword essential to maintain airway patency highlights the primary goal of tracheostomy care. Suctioning the tracheostomy tube regularly, as needed, is crucial to remove secretions that can accumulate and obstruct the airway, ensuring the client can breathe. While changing ties, humidifying air, and applying dressings are important aspects of tracheostomy care, they are secondary to maintaining a clear airway. For example, a client with thick secretions could quickly become hypoxic without proper suctioning. Always prioritize airway clearance when caring for a client with a tracheostomy. Question 16. A nurse is caring for a client who is NPO, nothing by mouth, and has a blood glucose level of 50 mg per deciliter. The client is lethargic but able to swallow. What is the nurse's priority action? A. Administer 1 ampoule of D50W intravenously. B. Give 4 ounces of orange juice. C. Administer glucagon intramuscularly. D. Notify the physician immediately. Answer: B. Give 4 ounces of orange juice. This question assesses your management of hypoglycemia, specifically when a client can still swallow. The keywords NPO, blood glucose level of 50 mg per deciliter, which is hypoglycemia, and lethargic but able to swallow are crucial. Because the client can swallow, the priority is to administer a rapid-acting carbohydrate orally to quickly raise blood glucose. Orange juice is an excellent choice. Administering D50W, dextrose 50% in water, intravenously or glucagon intramuscularly would be appropriate if the client were unconscious or unable to swallow. Notifying the physician is important but should follow immediate treatment for hypoglycemia if the client is able to take oral carbohydrates. For instance, giving a conscious client a sugary drink can prevent them from becoming fully unconscious. Always remember to treat an alert, hypoglycemic client with oral carbohydrates first. Question 17. The nurse is administering a pain medication intravenously. The client reports sudden shortness of breath, hives, and facial flushing. What is the nurse's initial action? A. Elevate the head of the bed. B. Administer diphenhydramine. C. Stop the medication infusion immediately. D. Prepare to administer epinephrine. Answer: C. Stop the medication infusion immediately. This question tests your immediate response to an acute adverse drug reaction, specifically an allergic reaction. The keywords sudden shortness of breath, hives, and facial flushing strongly suggest an anaphylactic or severe allergic reaction to the medication. The initial action in such a scenario is always to stop the suspected causative agent to prevent further exposure and worsening of the reaction. While elevating the head of the bed, administering antihistamines, like diphenhydramine or epinephrine might follow. Stopping the infusion is the absolute first step. Think of it like a fire. You stop adding fuel to the fire first. Always remember to discontinue the offending agent immediately when a severe adverse reaction occurs. Question 18. A nurse is teaching a client about a low-sodium diet. Which food choice indicates a good understanding of the teaching? A. Canned soup. B. Fresh fruits and vegetables. C. Deli meats. D. Frozen dinners. Answer: B. Fresh fruits and vegetables. This question focuses on dietary education for a low-sodium diet. The keyword low-sodium diet requires the client to identify foods naturally low in sodium or that have not had sodium added during processing. Fresh fruits and vegetables are naturally low in sodium and are excellent choices. Canned soups, deli meats, and many frozen dinners are typically high in sodium due to processing and preservatives. For example, choosing an apple and carrots instead of a slice of ham and a can of soup significantly reduces sodium intake. Always remember that fresh, unprocessed foods are generally the best choices for a low-sodium diet. Question 19. The nurse is preparing to insert a peripheral intravenous catheter. Which action demonstrates adherence to infection control principles? A. Wearing clean gloves during the procedure. B. Cleansing the site with an alcohol swab for 5 seconds. C. Palpating the vein after cleansing the site with an antiseptic. D. Performing hand hygiene before donning gloves. Answer: D. Performing hand hygiene before donning gloves. This question assesses your understanding of fundamental infection control principles during a common nursing procedure. The keyword adherence to infection control principles refers to practices that prevent the spread of microorganisms. Performing hand hygiene, either hand washing or using alcohol-based hand rub, before donning gloves is an essential step to reduce the microbial count on the nurse's hands, even if gloves are worn. While wearing gloves is important, if hands are not clean beforehand, microorganisms can still be transferred. Cleansing the site with antiseptic for insufficient time or palpating the vein after cleansing would compromise sterility. For example, imagine touching a sterile field with hands that haven't been washed, even if you put gloves on afterward. Always remember that hand hygiene is the cornerstone of infection prevention, even when gloves are used. Question 20. A client with hypertension is prescribed a thiazide diuretic. Which electrolyte imbalance is the nurse most concerned about? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer B. Hypokalemia. This question tests your knowledge of common side effects of diuretic medications. The keywords thiazide diuretic and most concerned about direct you to a frequent and potentially serious electrolyte imbalance. Thiazide diuretics work by increasing the excretion of sodium and water, but they also promote the excretion of potassium, leading to hypokalemia, low potassium levels. Hypokalemia can cause cardiac arrhythmias, muscle weakness, and other complications. While other imbalances can occur, hypokalemia is a prominent concern with thiazides. For example, a client on hydrochlorothiazide might need potassium supplements or to consume potassium-rich foods. Always remember to monitor potassium levels closely when a client is on a thiazide diuretic. Question 21. A nurse is caring for an older adult client who is confused and agitated. The client repeatedly tries to remove their intravenous line. What is the nurse's initial action? A. Apply wrist restraints to prevent removal. B. Reorient the client to time, place, and person. C. Assess for potential causes of the confusion and agitation. D. Ask a family member to sit with the client. Answer C. Assess for potential causes of the confusion and agitation. This question addresses managing acute confusion and agitation, especially in older adults. The keywords confused and agitated and initial action point to the need for a thorough assessment before intervention. While restraints, reorientation, or family presence might be considered, the initial and most appropriate action is to investigate the underlying cause of the confusion and agitation. Causes could include infection, e.g., UTI, medication side effects, hypoxia, pain, or electrolyte imbalances. Addressing the root cause is crucial for effective and safe care. For instance, if the client is hypoxic, restraints won't solve the problem and can even worsen it. Always remember to assess before you intervene when faced with a change in a client's mental status. Question 22. A client is admitted with left-sided heart failure. Which assessment finding would the nurse expect? A. Peripheral edema. B. Jugular venous distension. C. Crackles in the lungs. D. Hepatomegaly. Answer C. Crackles in the lungs. This question tests your understanding of the clinical manifestations of left-sided heart failure. The keyword left-sided heart failure indicates that the left ventricle is unable to pump blood effectively to the body, leading to a backup of blood into the lungs. This pulmonary congestion manifests as crackles, rales, on auscultation, dyspnea, shortness of breath, and orthopnea. Peripheral edema, jugular venous distension, and hepatomegaly are more commonly associated with right-sided heart failure, where blood backs up into the systemic circulation. For example, hearing a crackling sound, like rubbing hair between your fingers, signals fluid in the lung air sacs. Always remember that L4 left-sided heart failure means L4 lung symptoms. Question 23. A nurse is teaching a group of parents about preventing sudden infant death syndrome, SIDS. Which instruction is most important to include? A. Place the infant on their back to sleep. B. Use soft bedding and toys in the crib. C. Keep the infant's room warm to prevent chilling. D. Allow the infant to sleep in the parent's bed. Answer A. Place the infant on their back to sleep. This question focuses on critical infant safety education regarding SIDS prevention. The keyword most important for preventing sudden infant death syndrome, SIDS, highlights the primary recommendation from health authorities. Placing infants on their back to sleep, supine position, is the single most effective measure proven to reduce the risk of SIDS. Soft bedding, toys, overheating, and co-sleeping, sharing a bed with parents, are all risk factors that should be avoided. For instance, having the baby sleep on their stomach increases the risk of rebreathing exhaled air. Always remember back to sleep as the cornerstone of SIDS prevention. Question 24. A client with a urinary tract infection, UTI, is prescribed an antibiotic. The nurse should instruct the client to A. Stop the medication as soon as symptoms disappear. B. Increase fluid intake, especially cranberry juice. C. Limit fluid intake to reduce bladder irritation. D. Avoid urinating frequently to allow the bladder to rest. Answer B. Increase fluid intake, especially cranberry juice. This question assesses proper client education for managing a urinary tract infection. The keyword urinary tract infection, UTI, and instruct the client to require identifying an appropriate self-care measure. Increasing fluid intake helps to flush bacteria from the urinary tract, and cranberry juice may help prevent bacteria from adhering to the bladder wall. Stopping antibiotics early can lead to recurrence or antibiotic resistance. Limiting fluid intake can worsen the infection, and avoiding frequent urination allows bacteria to multiply. For example, drinking plenty of water helps dilute urine and makes you urinate more, washing out bacteria. Always remember that good hydration is key for managing and preventing UTIs. Question 25. The nurse is caring for a client with end-stage renal disease, ESRD, who is receiving hemodialysis. Which assessment finding indicates a potential complication during dialysis? A. Blood pressure of 130/70 mmHg. B. Heart rate of 78 beats per minute. C. Muscle cramps and dizziness. D. Client states they feel sleepy. Answer C. Muscle cramps and dizziness. This question tests your ability to identify complications during hemodialysis. The keywords hemodialysis and potential complication point to adverse effects that can occur due to the rapid fluid and electrolyte shifts. Muscle cramps and dizziness are common signs of hypotension, low blood pressure, a frequent complication of hemodialysis due to rapid fluid removal. While feeling sleepy can occur, and blood pressure/heart rate might be within a normal range, sudden muscle cramps and dizziness specifically indicate a physiological problem directly related to the dialysis process. For example, if a client's blood pressure drops too low during dialysis, they might feel lightheaded and their muscles might cramp. Always remember to monitor for signs of hypotension and electrolyte imbalances during dialysis. Question 26. A client with suspected meningitis is admitted to the hospital. Which precaution should the nurse immediately implement? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer B. Droplet precautions. This question assesses your knowledge of infection control, specifically for suspected meningitis. The keyword suspected meningitis indicates a potential for bacterial meningitis, which is primarily transmitted via respiratory droplets. Therefore, droplet precautions should be implemented immediately to prevent the spread of the infection. This includes wearing a surgical mask when within 3 feet of the client, along with standard precautions. Airborne precautions are for infections like tuberculosis, and contact precautions are for direct or indirect contact spread. For example, a nurse would wear a mask to protect themselves from respiratory droplets if the client coughs or sneezes. Always remember to initiate droplet precautions for clients with suspected or confirmed meningitis. Question 27. The nurse is assessing a client complaining of severe abdominal pain. Which finding would alert the nurse to a potential perforation of a gastric ulcer? A. Increased bowel sounds and diarrhea. B. Rigid, board-like abdomen and rebound tenderness. C. Gradual onset of dull, aching pain. D. Nausea and vomiting without fever. Answer B. Rigid, board-like abdomen and rebound tenderness. This question tests your ability to recognize life-threatening complications of gastrointestinal conditions. The keyword potential perforation of a gastric ulcer requires you to identify classic signs of peritonitis, which occurs when stomach contents leak into the abdominal cavity. A rigid, board-like abdomen and rebound tenderness are hallmark signs of peritonitis, indicating an acute abdominal emergency. Increased bowel sounds, gradual onset of dull pain, or nausea/vomiting without fever are not typically indicative of a perforation. Think of it as the body's protective mechanism causing severe muscle rigidity in response to irritation of the abdominal lining. Always remember that a rigid, board-like abdomen is a red flag for a perforated organ and peritonitis. Question 28. A nurse is providing care for a client receiving total parenteral nutrition, TPN. Which intervention is essential to prevent complications? A. Administer TPN at a rapid rate to ensure adequate nutrition. B. Change the TPN tubing every 24 hours. C. Monitor blood glucose levels regularly. D. Discontinue TPN once the client starts oral intake. Answer C. Monitor blood glucose levels regularly. This question assesses critical nursing interventions for clients receiving TPN. The keyword essential to prevent complications for total parenteral nutrition, TPN, points to a primary concern. TPN solutions are highly concentrated with glucose, which can lead to hyperglycemia, high blood sugar, if not closely monitored. Regular blood glucose monitoring is essential to detect and manage this complication, preventing serious issues like osmotic diuresis or infection. Administering TPN too rapidly can also cause hyperglycemia, and TPN is generally tapered, not abruptly stopped, when oral intake begins. For instance, a client on TPN might need insulin to manage elevated blood sugar levels. Always remember that diligent blood glucose monitoring is crucial for safe TPN administration. Question 29. The nurse is caring for a client with a history of seizures. The client suddenly experiences a tonic-clonic seizure. What is the nurse's priority action during the seizure? A. Insert a tongue blade to prevent biting. B. Restrain the client's limbs to prevent injury. C. Protect the client's head and ensure a patent airway. D. Administer an anti-epileptic medication orally. Answer C. Protect the client's head and ensure a patent airway. This question tests your immediate actions during a seizure. The keywords tonic-clonic seizure and priority action during the seizure direct you to safety measures. The primary goals during a seizure are to protect the client from injury and maintain a patent airway. Protecting the head, e.g., by placing a pillow or blanket underneath, and loosening tight clothing around the neck are vital. Inserting a tongue blade or restraining limbs can cause injury, and administering oral medication is unsafe during an active seizure. For example, if the client is on the floor, you would move nearby furniture to prevent them from hitting it. Always remember that safety and airway protection are the top priorities during an active seizure. Question 30. A client is prescribed furosemide, Lasix. The nurse knows to monitor for which adverse effect? A. Hypoglycemia. B. Constipation. C. Ototoxicity. D. Hypernatremia. Answer C. Ototoxicity. This question tests your knowledge of common adverse effects of loop diuretics. The keyword furosemide, Lasix, is a loop diuretic, and the question asks about a specific adverse effect. Ototoxicity, which means damage to the ear causing hearing impairment, tinnitus or hearing loss, is a known adverse effect of furosemide, especially when given in high doses or rapidly intravenously. While other electrolyte imbalances can occur, ototoxicity is a distinctive and serious side effect of furosemide that requires monitoring. Think of the O in furosemide potentially reminding you of ototoxicity. Always remember to warn clients about the risk of hearing changes when taking furosemide. Question 31. The nurse is providing discharge teaching to a client with a new prescription for an inhaled corticosteroid for asthma management. Which instruction is most important to prevent a common side effect? A. Take the medication only when you feel short of breath. B. Rinse your mouth with water after each use. C. Avoid vigorous exercise while using this inhaler. D. Increase your intake of calcium-rich foods. Answer B. Rinse your mouth with water after each use. This question focuses on client education for inhaled corticosteroids. The keyword most important to prevent a common side effect for inhaled corticosteroid directs you to preventing oral candidiasis, thrush. Inhaled corticosteroids can suppress local immune response in the mouth and throat, leading to fungal infections. Rinsing the mouth with water after each use helps remove medication residue, significantly reducing the risk of thrush. Inhaled corticosteroids are preventative, not for acute shortness of breath, and while calcium intake is important for long-term steroid use, oral rinsing is directly related to preventing a common local side effect. For example, failing to rinse can lead to a white coating and soreness in the mouth. Always remember to teach clients to rinse their mouth thoroughly after using an inhaled corticosteroid. Question 32. A client is admitted with deep vein thrombosis, DVT, and is prescribed heparin via continuous intravenous infusion. Which laboratory value should the nurse monitor to assess the therapeutic effect of heparin? A. Prothrombin time, PT. B. International Normalized Ratio, INR. C. Activated partial thromboplastin time, APTT. D. Platelet count. Answer C. Activated partial thromboplast time, APTT. This question tests your knowledge of anticoagulation monitoring. The keywords deep vein thrombosis, DVT, heparin via continuous intravenous infusion, and assess the therapeutic effect are critical. The activated partial thromboplastin time, APTT, is the specific laboratory test used to monitor the effectiveness of unfractionated heparin therapy. PT and INR are used to monitor warfarin, Coumadin, therapy, while platelet count is monitored for heparin-induced thrombocytopenia, HIT, but not for therapeutic effect. For example, the physician will typically order an APTT to be maintained at 1:5 to 2:5 times the control value. Always remember that APTT is for heparin, and PT/INR is for warfarin. Question 33. A nurse is caring for a client with a cast on the right arm. Which assessment finding requires immediate attention? A. Swelling distal to the cast. B. Client reports dull ache under the cast. C. Capillary refill of 4 seconds in the right fingers. D. Skin around the cast edges is dry. Answer C. Capillary refill of 4 seconds in the right fingers. This question focuses on neurovascular assessment for a client with a cast. The keyword requires immediate attention for a cast on the right arm directs you to signs of compromised circulation or nerve function. A capillary refill of 4 seconds indicates delayed blood flow to the fingers, which could be a sign of compartment syndrome or excessive swelling under the cast, potentially leading to permanent tissue damage. While some swelling and a dull ache can occur, a prolonged capillary refill suggests a more urgent issue. Dry skin is not an urgent finding. For example, if circulation is cut off for too long, the tissues can die. Always remember that any signs of impaired circulation, sensation, or movement distal to a cast need immediate investigation. Question 34. A client with a history of chronic alcoholism is admitted with confusion, ataxia, and nystagmus. The nurse anticipates the physician will order which vitamin supplement? A. Vitamin C. B. Folic acid. C. Thiamine, vitamin B1. D. Riboflavin, vitamin B2. Answer: C. Thiamine, vitamin B1. This question tests your understanding of nutritional deficiencies associated with chronic alcoholism. The keywords chronic alcoholism, confusion, ataxia, and nystagmus describe Wernicke-Korsakoff syndrome, which is caused by a severe deficiency of thiamine, vitamin B1. Thiamine is crucial for brain function, and alcohol interferes with its absorption and utilization. Therefore, thiamine supplementation is essential to prevent or treat this neurological complication. While folic acid deficiency is also common in alcoholics, it doesn't manifest with these specific neurological symptoms. For instance, without thiamine, brain cells cannot properly metabolize glucose, leading to damage. Always remember that thiamine deficiency is a critical concern in chronic alcoholism, often presenting with neurological symptoms. Question 35. A nurse is teaching a client about self-monitoring blood glucose, SMBG. Which action demonstrates correct technique? A. Squeezing the finger vigorously to obtain a blood sample. B. Using the same fingerstick site repeatedly to save time. C. Pricking the side of the fingertip, rather than the center. D. Cleaning the finger with alcohol and then blowing on it to dry. Answer: C. Pricking the side of the fingertip, rather than the center. This question evaluates the correct technique for self-monitoring blood glucose. The keyword correct technique requires identifying a practice that promotes comfort and accuracy. Pricking the side of the fingertip is recommended because it has fewer nerve endings, making it less painful than the center, and still provides an adequate blood sample. Squeezing vigorously or using the same site repeatedly can cause tissue damage and pain. Blowing on an alcohol-clean site reintroduces bacteria and doesn't allow proper drying. For example, using the side of the finger allows you to rotate sites and avoid developing calluses. Always remember to use the sides of the fingertips for less painful and more effective blood glucose testing. Question 36. A nurse is providing care for a client with a peripheral foresight. Which observation indicates phlebitis? A. Edema, coolness, and pallor at the site. B. Redness, warmth, and pain along the vein. C. Blanching and streaking along the vein. D. Blood return present when the bag is lowered. Answer: B. Redness, warmth, and pain along the vein. This question tests your ability to identify complications of intravenous therapy, specifically phlebitis. The keyword phlebitis refers to inflammation of the vein. The classic signs of phlebitis are redness, warmth, pain, and tenderness along the course of the vein. Edema, coolness, and pallor are indicative of infiltration, not phlebitis. Blanching and streaking along the vein are not typical signs of phlebitis. Blood return simply indicates the catheter is in the vein, not necessarily a complication. For instance, if you see a red, tender line going up the client's arm from the foresight, that's likely phlebitis. Always remember that phlebitis is characterized by an inflamed, painful vein. Question 37. The nurse is caring for a client who is experiencing an acute asthma exacerbation. Which medication would the nurse expect to administer first? A. Oral prednisone. B. Inhaled albuterol. C. Intravenous magnesium sulfate. D. Inhaled fluticasone. Answer B. Inhaled albuterol. This question assesses your prioritization of medications in an acute respiratory emergency. The keywords acute asthma exacerbation and administer first direct you to the most rapid-acting bronchodilator. Inhaled albuterol is a short-acting beta agonist, SABA, that provides rapid relief of bronchospasm, making it the first-line treatment for acute asthma attacks. Oral prednisone and inhaled fluticasone are corticosteroids used for long-term control or later in an exacerbation, and intravenous magnesium sulfate is reserved for severe, life-threatening exacerbations. For example, giving albuterol immediately helps open up the airways so the client can breathe easier right away. Always remember that albuterol is the go-to medication for quick relief during an asthma attack. Question 38. A client is receiving a blood transfusion and develops sudden chills, fever, and lower back pain. What is the nurse's immediate action? A. Slow the transfusion rate and observe. B. Administer an antipyretic for the fever. C. Stop the transfusion immediately. D. Obtain a blood culture from the client. Answer C. Stop the transfusion immediately. This question tests your critical response to a suspected transfusion reaction. The keywords sudden chills, fever, and lower back pain are classic signs of an acute hemolytic transfusion reaction, a life-threatening complication. The immediate action is to stop the transfusion immediately to prevent further infusion of incompatible blood and minimize the severity of the reaction. Slowing the rate, administering medication, or obtaining cultures are all secondary actions that might follow after stopping the transfusion. For example, continuing the transfusion could lead to kidney failure or severe shock. Always remember that if you suspect a transfusion reaction, stop the infusion immediately and disconnect the tubing from the client. Question 39. A nurse is preparing to administer medications through a nasogastric (NG) tube. What is the most important step to ensure safe medication administration? A. Crush all medications into a fine powder. B. Mix all medications together before administration. C. Verify tube placement before administering medications. D. Flush the tube with water after administering all medications. Answer C. Verify tube placement before administering medications. This question focuses on safe medication administration via an NG tube. The keyword most important step to ensure safe medication administration highlights a critical safety check. Verifying proper tube placement, e.g., by checking pH of aspirate or observing for signs of respiratory distress, is paramount to prevent aspirating medications into the lungs, which can lead to pneumonia. While crushing medications, individually, flushing the tube, and administering medications separately are important, they are secondary to confirming the tube is in the correct location. For example, if medications are given into the lungs, it can cause severe respiratory complications. Always remember that confirming NG tube placement is a non-negotiable safety check before administering anything through it. Question 40. The nurse is caring for a client with Clostridium difficile, C. diff, infection. Which infection control measure is most appropriate? A. Wear a surgical mask when entering the room. B. Use an alcohol-based hand sanitizer before and after client care. C. Wear gloves and a gown for all client contact. D. Place the client in a negative pressure isolation room. Answer C. Wear gloves and a gown for all client contact. This question assesses your knowledge of specific infection control precautions. The keyword Clostridium difficile, C. diff, infection indicates the need for contact precautions. C. diff is primarily spread through direct contact with contaminated surfaces or fecal matter. Therefore, wearing gloves and a gown for all client contact and during care that may involve contact with the client's environment is the most appropriate and effective measure. Alcohol-based hand sanitizers are not effective against C. diff spores. Handwashing with soap and water is essential. Negative pressure rooms are for airborne infections, not C. diff. For example, failing to wear a gown and gloves can lead to the spread of spores to other clients. Always remember that contact precautions, including soap and water handwashing, are crucial for C. diff. Question 41. A client with a head injury develops a Glasgow Coma Scale, GCS, score that decreases from 13 to 9. What is the nurse's priority action? A. Continue to monitor vital signs every hour. B. Administer pain medication as prescribed. C. Notify the physician immediately. D. Reorient the client to time and place. Answer C. Notify the physician immediately. This question tests your critical thinking and prioritization in neurological assessments. The keywords head injury and GCS score that decreases from 13 to 9 indicate a significant and concerning change in neurological status. A decreasing GCS score signifies worsening intracranial pressure or neurological deterioration, which is a medical emergency. The priority action is to immediately notify the physician, as this change requires urgent medical evaluation and intervention to prevent further brain damage. Monitoring vital signs, administering pain medication, or reorienting the client are important but do not address the urgent need for medical assessment of the deteriorating neurological status. For instance, a delay in reporting this change could result in irreversible brain injury. Always remember that a significant drop in GCS score is a neurological emergency requiring immediate physician notification. Question 42. A nurse is administering a purified protein derivative, PD, skin test for tuberculosis screening. Which instruction should the nurse provide to the client? A. Avoid getting the injection site wet for 24 hours. B. Return to the clinic in 48 to 72 hours for the result to be read. C. If the area gets red, it means you have tuberculosis. D. You will need to take an antibiotic if the test is positive. Answer B. Return to the clinic in 48 to 72 hours for the result to be read. This question assesses your knowledge of the PPD skin test procedure and client education. The keyword PPD skin test requires you to know the critical time frame for reading the result. The test site must be read by a healthcare professional within 48 to 72 hours after injection to accurately assess for induration, a palpable, raised, hardened area, which indicates a positive reaction. Avoiding water for 24 hours is incorrect. Redness alone is not a positive sign, induration is key, and a positive test doesn't automatically mean active TB or require antibiotics immediately without further testing. For example, if the client waits too long to have the test read, the result might be inaccurate. Always remember the crucial 48 to 72 hour window for PPD test reading. Question 43. A nurse is conducting dietary teaching for a client with newly diagnosed celiac disease. Which food item should the nurse instruct the client to avoid? A. Rice. B. Corn. C. Wheat bread. D. Potatoes. Answer C. Wheat bread. This question tests your knowledge of dietary management for celiac disease. The keywords newly diagnosed celiac disease and instruct the client to avoid direct you to foods containing gluten. Celiac disease is an autoimmune disorder triggered by gluten, a protein found in wheat, barley, and rye. Therefore, wheat bread must be avoided. Rice, corn, and potatoes are naturally gluten-free and generally safe for clients with celiac disease. For example, eating wheat bread would cause intestinal damage and symptoms like diarrhea and abdominal pain. Always remember that clients with celiac disease must strictly avoid all foods containing wheat, barley, and rye. Question 44. The nurse is caring for a client immediately post-cardiac catheterization via the femoral artery. Which action is the priority for the nurse? A. Encourage oral fluid intake. B. Assess the insertion site for bleeding or hematoma. C. Ambulate the client to the bathroom. D. Monitor vital signs every 4 hours. Answer B. Assess the insertion site for bleeding or hematoma. This question focuses on immediate post-procedure care after a cardiac catheterization. The keywords immediately post-cardiac catheterization via the femoral artery and priority highlight the most urgent concern. The femoral artery is a large vessel, and there is a significant risk of bleeding or hematoma formation at the insertion site after the sheath is removed. Therefore, frequent assessment of the site for these complications is the top priority to prevent serious blood loss. Ambulation is contraindicated immediately after the procedure. Fluid intake is important but not the priority for safety, and vital signs should be monitored more frequently than every 4 hours initially. For instance, a rapidly expanding hematoma can cause hypovolemic shock. Always remember to prioritize monitoring for bleeding at the access site after procedures involving arterial puncture. Question 45. A nurse is planning care for an infant with bronchiolitis caused by respiratory syncytial virus, RSV. Which intervention is most important? A. Administer antibiotics as prescribed. B. Provide humidified oxygen. C. Encourage a low-sodium diet. D. Isolate the infant using airborne precautions. Answer B. Provide humidified oxygen. This question assesses your understanding of care for infants with RSV bronchiolitis. The keywords infant with bronchiolitis caused by respiratory syncytial virus, RSV, and, most important, direct you to an intervention that supports respiratory function. RSV bronchiolitis causes inflammation and mucus production in the small airways, leading to respiratory distress. Humidified oxygen helps loosen secretions, improve oxygenation, and ease breathing. Antibiotics are not effective against viral infections, a low-sodium diet is irrelevant, and RSV requires droplet and contact precautions, not airborne. For example, infants with RSV often struggle to breathe and feed, so supporting oxygenation and clearing airways is crucial. Always remember that maintaining oxygenation and airway clearance are paramount in infants with RSV bronchiolitis. Question 46. The nurse is assessing a client taking lithium for bipolar disorder. Which finding indicates potential lithium toxicity? A. Fine hand tremor. B. Polyuria and polydipsia. C. Nausea, vomiting, and diarrhea. D. Sedation and weight gain. Answer C. Nausea, vomiting, and diarrhea. This question tests your knowledge of medication side effects and toxicity for a specific psychiatric medication. The keywords lithium for bipolar disorder and potential lithium toxicity are critical. Early signs of lithium toxicity often include gastrointestinal symptoms such as nausea, vomiting, and diarrhea, along with muscle weakness and tremors. While fine hand tremors, polyuria, polydipsia, and mild sedation can be common side effects at therapeutic levels, new onset or worsening GI symptoms often signal rising lithium levels to a toxic range. For example, if a client suddenly develops profuse diarrhea and is feeling very nauseous, you should suspect toxicity and check their lithium level. Always remember that GI upset is an early red flag for lithium toxicity. Question 4-7. A client is prescribed phenelzyne, Nardil, a monoamine oxidase inhibitor, MAOI. Which food item should the nurse instruct the client to strictly avoid? A. Fresh fruits. B. Aged cheese. C. Cooked vegetables. D. Plain pasta. Answer: B. Aged cheese. This question assesses your understanding of critical drug-food interactions for MAOIs. The keywords phenelzyne, Nardil, a monoamine oxidase inhibitor, MAOI, and strictly avoid direct you to foods containing tyramine. MAOIs inhibit the enzyme that breaks down tyramine, leading to a dangerous buildup that can cause a hypertensive crisis, severely high blood pressure. Aged cheeses, cured meats, red wine, and fermented products are high in tyramine. Fresh fruits, cooked vegetables, and plain pasta are safe. For instance, eating a slice of aged cheddar while on phenelzyne could cause a sudden, life-threatening spike in blood pressure. Always remember that clients on MAOIs must adhere to a strict tyramine-free diet to prevent a hypertensive crisis. Question 48. A client has a chest tube connected to a chest drainage system. The nurse observes continuous bubbling in the water seal chamber. What does this finding indicate? A. Normal functioning of the system. B. A leak in the chest tube system. C. The lung has fully re-expanded. D. The suction is too high. Answer: B. A leak in the chest tube system. This question tests your knowledge of chest tube drainage system assessment. The keywords continuous bubbling in the water seal chamber and chest tube are important. Continuous bubbling in the water seal chamber, not associated with exhalation or coughing, which is expected intermittent bubbling, indicates an air leak within the chest tube system or from the client's lung. Intermittent bubbling that rises and falls with respirations, tidling, is normal. The lung fully re-expanding would lead to a cessation of bubbling, and excessive suction would cause continuous bubbling in the suction control chamber, not necessarily the water seal. For example, if you see constant, vigorous bubbling unrelated to breathing, you should immediately check all connections for a leak. Always remember that continuous bubbling in the water seal chamber means there's an air leak that needs to be located and fixed. Question 49. The nurse is providing discharge teaching for a client with new onset urge incontinence. Which instruction is most appropriate? A. Drink less fluid throughout the day. B. Perform Kegel exercises regularly. C. Empty your bladder only when it feels full. D. Wear absorbent pads to manage leaks. Answer: B. Perform Kegel exercises regularly. This question focuses on management strategies for urinary incontinence. The keywords new onset urge incontinence and most appropriate highlight interventions aimed at strengthening pelvic floor muscles and improving bladder control. Kegel exercises strengthen the pelvic floor muscles, which can help control involuntary bladder contractions and reduce urgency. Drinking less fluid can lead to dehydration and concentrated urine, which irritates the bladder. Emptying the bladder only when full can worsen urgency, and absorbent pads manage symptoms but don't treat the underlying problem. For example, Strengthening these muscles can help you hold urine longer and prevent sudden leaks. Always remember that Kegel exercises are a fundamental intervention for managing urge and stress incontinence. Question 50. A client with a new diagnosis of HIV is concerned about transmitting the virus to their partner. Which statement by the nurse best addresses the client's concern? A. HIV is only transmitted through sexual contact, so avoid sex. B. Consistent and correct use of condoms is highly effective in preventing transmission. C. As long as you both get tested regularly, transmission risk is low. D. You should avoid all intimate contact to ensure no transmission occurs. Answer: B. Consistent and correct use of condoms is highly effective in preventing transmission. This question addresses client education on HIV transmission prevention. The keywords new diagnosis of HIV, transmitting the virus to their partner, and best addresses the client's concern require accurate and practical advice. Consistent and correct use of condoms is a highly effective and widely recommended method for preventing sexual transmission of HIV. While abstinence, avoiding all intimate contact, would prevent transmission, it may not be a realistic or desired option for the client. HIV can also be transmitted through sharing needles, not just sexual contact. Regular testing helps identify infection but doesn't prevent transmission. For example, using a condom correctly every time you have sex significantly reduces the chance of passing the virus. Always remember that safe sex practices, especially consistent condom use, are crucial for preventing HIV transmission.